Hi, my name is Dr. Eric Ball. I'm a pediatrician with the CHOC Primary Care Network. I'm here today to talk to you about the effects of the COVID-19 pandemic on our practitioners and our patients and their families, and how the training that we practitioners receive through ACEs Aware has helped us to become better practitioners and also to empower our patients to deal with the pandemic in a more healthy way. We've all been on a mental health roller coaster over this past year during the COVID-19 pandemic. As you probably recall, at the beginning, there was a coming together in what we call the honeymoon phase, where most of us felt that we were in this as a community, in it together with a common enemy. Although over the past several months, we've all been in this disillusionment phase. In this phase, we're all feeling down and depressed and worried that this is going to last for a very long period of time. Now, over a year into this pandemic, we're starting to see the mental health effects of the pandemic and the mitigation effects related to the pandemic on both ourselves and our patients and their families. I want to talk briefly about the way that this COVID-19 pandemic has been affecting our patients, and in particular young people. I like this survey that was put out in the middle of the pandemic called The State of Young People During COVID-19. It asked a large, diverse group of children and adolescents how the pandemic and mitigation effects have been affecting them. The first thing they asked was they looked at how this is affecting their educational situation and how they are learning. Most of the people interviewed in this were doing primarily distance learning, and over half were spending no time directly in the classroom. And this was very problematic for kids because it took away from their community and from their social support networks. When we looked at how connected our patients felt during this time, we felt that more than half were disconnected with both their school community, their school adults, and their classmates. This is very problematic, as you know from our adverse childhood experience literature, because strong connected relationships is vital to allow children to get through difficult times. We also found that children at this time were having more concerns about things that they really shouldn't be concerned about in normal times. They were concerned about their own health and their family's health, their family's financial situation, their education, and a substantial percentage were afraid of their own basic needs, including food, medicine, safety, and shelter. These are problems that children and adolescents should not have to deal with, and they were having very difficult times during the pandemic. We also then, in this study, looked at youth reporting poorer emotional and cognitive health. And the people conducting the study showed that upwards of 50% of families and 50% of students were having poor emotional health. And this was not equally distributed. The researchers found that this was higher in populations who had parents who were born outside of the US. And the theory behind this is that these are likely people who were in essential provider roles, such as grocery workers or healthcare providers, and therefore they are at higher risk for getting sick with the COVID-19 pandemic. The next thing the study looked at was, whether these students would benefit from mental health support. And 1 in 4 actually acknowledged that they were feeling depressed and had a frank mental health illness during this COVID-19 pandemic. And most recognized that they would find support helpful when it was offered. The problem was it wasn't offered very much, and part of this was because they were disconnected from their communities. Shifting gears a little, I want to talk about how the COVID-19 pandemic has been affecting parent-child psychological well-being. This is a study which was recently published, which looked at difficulties that families were having at home related to the COVID-19 pandemic and mitigation effects. This looks at job losses, income losses, caregiver burden, and household illness. And what they found in this study was that children and adults had mental health issues that were directly proportionally related to the number of household adversities that were happening due to the COVID-19 pandemic. This was interesting because this is exactly what we see with adverse childhood experiences. It's almost a dose-dependent effect. The more that the pandemic was affecting the family and the household, the worse the child was from a mental health perspective. Another thing that we've been seeing greatly is mental health emergency department visits during the COVID-19 pandemic. As a primary care pediatrician, I have seen more mental health emergencies over this past year than I had in the previous 15 years of my practice combined. This is a study that was recently done showing mental health emergency visits during the pandemic, and obviously there's a huge uptick right when the lockdown started in mid-March of 2020, and it's continued to this day. Another study, which was published in February of 2021, looked at all sorts of mental health emergencies that were coming to emergency departments during the pandemic. These included drug and opioid overdoses, intimate partner violence, suicide attempt, and other mental health conditions. And what they showed was that there was a huge uptick in the amount of mental health ER visits, which started almost exactly when the lockdown began. And these have persisted up until today. And these effects are not only affecting our patients and our families, but the effects of the COVID-19 pandemic are also affecting us as practitioners. We are also having difficulty both financially and emotionally. We've seen cases of doctors who have committed suicide due to the trauma of all of the death and hardships that we've seen. And then most of us are suffering financial burdens just like everyone else due to practices closing down, decreasing patient visits because they're fearful of coming to the office. So this is a problem that's not only affecting our patients and our families, but also ourselves. And one of the things we learned through ACEs Aware is that it's not only critical to take care of our families, but also to practice what we preach and make sure that we are taking care of ourselves. So let's talk briefly about how the COVID-19 pandemic and all of these mitigation effects is affecting our patients from an ACEs Aware way. So in the ACEs literature, we talk about positive stress, tolerable stress, and toxic stress. Positive stress is the normal stresses that we go through on a day-to-day basis or a year-to-year basis. These are things that are difficult. They cause elevations in our stress response, but they're good for us. They kind of train us. For example, a positive stress would be your first day of school. It's important that you learn the ways to get through those times, because if you had no stress in your life, you would never learn how to deal with adversity. Tolerable stress are very difficult situations that activate the body's stress response in response to a long-lasting or a very difficult situation, but they are buffered by supportive relationships or other buffering factors that we'll talk about soon. Toxic stress is prolonged activation of the stress response in the absence of these buffering relationships and responses. COVID-19 is an extremely stressful experience for all of us. And for many of us, it's the most stressful experience we've ever had. The way we deal with it has to do with the way that we use these buffering relationships and our resiliency factors to get through these difficult times. I don't think anyone thinks COVID-19 has been a positive stressful event, but whether it affects you as tolerable stress or toxic stress really has to do with how you are dealing with the current pandemic and what you have around you in supportive relationships. Let's now talk about how we could protect ourselves and our patients during the stress and adversity of COVID-19. As a primary care pediatrician, I learned a lot from taking my ACEs Aware training. I took my training in 2019 thinking it would be applicable only to patients who were suffering from high levels of childhood adversity and children who had high ACEs screening scores. But one thing I learned quickly during the COVID-19 pandemic is that the lessons I learned from my ACEs Aware training can be directly applied to myself and my patients and families who are suffering adversity due to the COVID-19 pandemic. And the resiliency factors that we are teaching our families at this point are exactly the same as the ones that we use for children who are suffering high levels of childhood adversity. So let's go through them quickly. The Surgeon General of California calls these the stress busters that we can use to mitigate high levels of childhood adversity. So number one is to maintain supportive relationships. This is done sometimes easier during the COVID-19 pandemic because we're all stuck at home with our families. But that's assuming you are with a loving family who provides that supportive relationship. For those children or other people who are not in a safe or secure family, they can look for these supportive relationships other places. We as practitioners can serve as those supportive relationships. And during the COVID-19 pandemic, I have certainly created some bonds with some of my patients who just need someone to talk to during these difficult times. I think it's important that you encourage your families to reach out to mentors, friends, and family members by video chat or other mechanisms, and to reach out to community or faith-based organizations. During this time, it's extremely important that they engage in daily exercise. Our goal is at least 60 minutes a day of exercise. And although this is harder with gyms and sports being closed down, simply going for a walk around the block or getting outside is more than enough to keep yourself in good shape, both mentally and physically. We always talk about high quality sleep, but it's even more important during these difficult times. Our goal is for kids to get an adequate amount of sleep every day based on how old they are. It's important that they maintain some semblance of a sleep routine and go to bed and wake up at a similar time each day, regardless of whether the children are in person school or not. We find that some of our kids are staying up very late now because they are not in school and don't have to wake up early to go to class. And we find that this is causing a detrimental impact on their mental and physical health. One thing we always talk about with our families is having a digital curfew, turning off electronics before they go to bed to allow their brain to settle down and allow them to go to sleep more easily. Another thing that's very important during the COVID-19 pandemic is to make sure that people have balanced nutrition. It's extremely important to have regular meal times, and we encourage families to eat together always, but especially during these difficult times. It's also important that we try to have children limit snacking, especially on things that have refined carbohydrates, have high fat or high sugar levels. It's also very important right now for people to engage in mental health care if necessary. I have referred a lot of my patients to therapy during the COVID-19 pandemic, more than I ever have in the past. And I find that a trusting relationship with a mental health professional is valuable for many of my families to get through these difficult times. And finally, go outside. We're all trapped inside for our own safety, but getting outside into nature is really critical. And it's safe to do as long as you continue socially distancing from other people. Take a walk, take a hike, get out of your house. It really is good for your mental health. I want to talk really briefly about how this has affected one of my patients directly. So I recently did a well-child check with a 13-year-old patient who I've known for his entire life. He has had no mental health problems in the past and really has a very privileged and easy upbringing. I had no expectations for this visit. I thought it would be a routine, easy well-child check. And we gave him our mental health screening tool that we do for all of our adolescent patients. I was very surprised to see the results showed that he had a depression screening score of 13, which puts him in the moderate depression stage. When I talked to the patient and his mother, he talked about how he was feeling down because the sports that he previously engaged in had been canceled and he no longer was playing soccer or baseball. He was spending most of his time indoors playing video games and hanging with himself in his bedroom. He's been distance learning since late March, so almost a year now, and he's in 7th grade. This is the first year he's been in middle school, and he's found the transition to middle school quite difficult. He was very sad that he missed his elementary school graduation, and mom thought he might have ADHD because he was previously a straight A student and now is getting B's and C's. Interestingly, when we did his ACEs screening, his ACE score was 0. So we had to discuss with this patient and his parents how the COVID-19 pandemic was affecting him. So clearly something had changed over the past year and he was suffering from the mitigation efforts due to the pandemic. We talked about the resiliency factors and I gave him, like I do for many patients, the Surgeon General's playbook for stress relief during COVID-19. We talked about sleep hygiene. He was sleeping very poorly and staying up till 1 or 2 in the morning playing video games. We discussed the importance of exercise. This was a child who was previously getting an hour or 2 of exercise every day and now is getting almost no exercise. We downloaded a meditation app on his phone and I showed him how to use it. And we actually spent a few minutes meditating in my office. And then I referred him to a local child psychologist for therapy. Now, this is a patient who had an ACE score of 0 and a patient who normally I would not have had to talk about this. But because of the COVID-19 pandemic, I'm asking the questions about resiliency for every one of my patients. Every patient I am seeing is being affected by COVID-19 pandemic, including myself, including my colleagues. And I think it's important to remember that the COVID-19 and the associated public health mitigation efforts are the most traumatic moments of many of these families' lives. I'm calling this a collective societal trauma. Even for those families who have ACEs score of 0, this has been an extremely traumatic event, and the resiliency factors and the stress-busting strategies that we learned during ACEs Aware training are directly applicable to this pandemic. And it's important and critical that you discuss these strategies with all of your patients and all of your families, regardless of their ACEs score. I think it's important to remember, to close, that we can reduce the short and long-term effects of the COVID-19 pandemic. And the ACEs Aware initiative and the training that we all take with ACEs Aware can certainly help us to all learn those techniques and make us better practitioners and improve the lives of our families. Thank you so much for your time.